Recording in progress.
Good morning, everyone. We will go ahead and get started. A copy of the Open Meetings Act is located on the wall and also out at the desk, as well as on our county website. There is also an automatic external defibrillator that's available on the back wall of the legislative chambers. Please stand for the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation under God, indivisible, with liberty and justice for all. This morning, we're going to move a couple things around. We're going to start with the agenda for the Douglas County Board of Commissioners, and then we'll do a couple of recognition proclamations, and then we'll move back to our regular agenda flow. So with that, roll call for the Douglas County Board of Commissioners.
Commissioner Boyle.
Here.
Commissioner Kavanaugh.
Here.
Commissioner Friend.
Here.
Commissioner Garcia.
Here.
Commissioner Morgan.
Here.
Commissioner Rogers. Madam Chair.
Present. We have two recognition and proclamations. We're going to do item B first, the resolution recognizing Vic Gutman and Associates for their work on the Do Right, Do Now COVID-19 prevention campaign. And if y'all could just come to the front there, I'm going to read the resolution. Whereas in the fall of 2020, Vic Gutman and Associates, an Omaha-based public relations firm, recognized a need for a consistent, unified, citywide message around COVID-19 prevention. And whereas FGA called upon Dr. Adi Poor, former director of the Douglas County Health Department, to propose the idea of bringing local healthcare providers, media outlets, and community partners together to support the campaign. And whereas in collaboration with the local agency eCreative, VGA developed and launched the Do Right, Right Now campaign on November 18th, 2020. And whereas a word of the campaign spread beyond Omaha, VGA was approached by the Nebraska Department of Education and Nebraska Children and Families Foundation to expand the campaign statewide. And whereas VGA volunteered as project management services for the Douglas County portion of the 11-month campaign, hours totaling more than $76,000 in donated time. And whereas VGA called upon more than 25 local Omaha area media outlets and over 150 statewide media partners soliciting in-kind ad space, airtime, and media coverage that amounted to more than $672,000 in value. And whereas over its 11-month run, the campaign generated more than 540,000 social media impressions, 1,830 mentions and stories across 186 media outlets, engaged 31,000 users on the DoRightRightNow.org website, and distributed printed material through over 620 partnering organizations. And whereas through media partnerships, social media, community collaborations, and outreach to underserved communities using influencers and non-traditional communication methods, the Do Right, Right Now campaign reached underserved communities throughout the state and provided factual information and resources in a consistent, unbiased, accessible way. Now therefore be it resolved by this Board of Commissioners, Douglas County, Nebraska, that this board hereby recognizes Vic Gutman and Associates for their work on the Do Right, Right Now COVID prevention campaign and honors their efforts in the fight against COVID-19. And with that, I would ask for a motion to approve.
Second.
Would you like to make any comments?
Yes, good morning, and
Morning.
thank you. My name is Beth Kramer, and I am with my colleague Diana Gleisberg Meredith. Unfortunately, two other members of our team, Laura Paulson and Lisa Witten, are not available today, but we just on behalf of Vic Gutman Associates wanted to say thank you. Thank you for the opportunity. Thank you for believing in us and our idea. This is something that no one really knew what we were getting into when we started this project. And in September 2020, we took this on and we worked with Dr. Adi Poor. And the Douglas County Health Department and the board were incredibly supportive. And as you mentioned, I mean, you talked about a lot of the statistics, and frankly, we are thrilled with the amount of connections that we made statewide and the amount of in-kind donations. Our media outlets statewide were absolutely fantastic. You mentioned that we raised over $506,000 for this campaign. And it really was. We had people in small communities in western Nebraska that were using our materials. So on behalf of the Vic Gutman Associates, thank you so very much for your support, your confidence, and the opportunity for us to participate in this project.
Well, again, we couldn't thank you enough for what all you've done, and again, it was amazing to see it launch all the way throughout the state, and so that means good work throughout the state, so we appreciate all of that. With that, let's go ahead and vote, and then if you would, we'll have you come around and
Sure.
we'll get a picture with the resolution.
Motion passes 7-0.
Okay, here we go. Ready? Look here first, not at Phil. 1, 2, 3. One more? 1, 2, 3.
Didn't tell him to smile.
Great smiles.
Who can tell?
Thank you so very much. I'm so grateful.
Tuck your head in it. Thank you, Beth.
Oh, thank you so
Shut
much.
up, you bet.
Thank you, Phil.
We do have one more recognition proclamation we'll do before we go back to our regularly flowed schedule. Resolution designating March 2022 as Irish American Heritage Month in Douglas County and proclaiming March 1st, 2022 as Daniel and Greta Mulhall Day. This is brought to us by Commissioner Kavanaugh and Commissioner Boyle. I don't know who's going to read the resolution, but
Happy to, thank you. I'm glad to have an opportunity to bring this resolution recognizing the Irish American community and coming up on Irish American Heritage Month in March. It's particularly poignant for me today because today would have been my brother Tom's 70th birthday. And I'm remembering him as well as all the great Irish Americans who made contributions to our community since its foundation. And so, along those lines, we are entertaining a resolution that reads as follows. Whereas, for the first time ever, the Irish ambassador to the United States of America, Mr. Daniel Mulhall, will visit Nebraska from February 26, 2022 through March 1st, 2022. And whereas Ambassador Mulhall and his wife, Mrs. Greta Mulhall, will be honored guests at the Nebraska Statehood Dinner celebrating the admission of the great state of Nebraska to the United States on March 1st, 1867. And whereas immigrants from Ireland played a prominent role in the establishment of the state of Nebraska and the founding of the city of Omaha and Douglas County, and whereas Irish American Heritage Month was first celebrated by proclamations of the President of the United States in 1991, and whereas Mr. and Mrs. Mulhall will be the guests of honors for the Douglas County Irish American community for the launch of Irish American Heritage Month on March 1st, 2022, and whereas Irish American Heritage Month culminates with St. Patrick's Day on March 17th and celebrates the many significant Irish American contributions to our community, our state, and our nation. And whereas 2022 is the 150th anniversary of Omaha's St. Patrick's Day Parade and the 100th anniversary of Irish independence. This year is also the 20th anniversary of the twinning of Omaha, Douglas County, USA, and Naas, County Kildare, Ireland, and will be celebrated with a visit by Naas Mayor Emeritus Timmy Conway. Now, therefore, be it resolved by this Board of County Commissioners, Douglas County, Nebraska, that this board hereby designates March 2022 as Irish American Heritage Month in Douglas County and proclaims March 1st, 2022 as Daniel and Greta Mulhall Day, dated this 8th day of February, 2022.
We have a motion to approve.
I would move.
There is a motion and a second. Commissioner Boyle?
Yes, just a few other things. Of course, I'm very proud that Commissioner Kavanaugh asked me to co-sponsor this. When I think of being Irish, to be honest, I think of my dad. So there are just he was the iconic Irishman, the guy who laughed hard, who cried hard, he wore his heart on his sleeve, and so there's just a couple statements that he would always say that would make me laugh, and that's how I remember him. One is, if you tell a story 3 times, it becomes true.
Yep.
It becomes true. Yep. So that's a Mike Boyle for you.
Yep.
And so, and then it's the famous saying, you know, if you to be able to be in heaven an hour before the devil knows you're dead. so anyway,
he made it.
yeah, I think he probably. I'm hoping he made it. I don't know. You all be the ones to kind of judge that. I would assume. So anyway, I appreciate being on this. Being on this resolution, and in honor of my dad, I would appreciate approval.
Oh, great. With that, please vote. Yes, Commissioner Boyle?
Motion passes 7-0.
One more thing, just never let the truth get in the way of a good story. That was his famous line too.
Yes. He used to say that actually at this board meeting.
I'm sure he did.
All right, very good. With that, we will, is there a motion to recess out of the Board of Commissioners and go into the Board of Equalization?
Yeah.
Motion by Commissioner Rogers, second by Commissioner Morgan. Please vote.
Motion passes 7-0.
And could we have roll call for Board of Equalization?
Commissioner Boyle. Commissioner Kavanaugh. Commissioner Friend. Commissioner Garcia. Commissioner Morgan. Commissioner Rogers. Madam Chair.
Present. Item A, approval of the minutes of the Board of Equalization meeting held Tuesday, February 1st, 2022. And item B, call for a meeting and set March 1st, 2022 as a date for hearing on certified assessment corrections reflecting the addition of omitted property to the tax rolls or increased value on property. Is there a motion to approve A and B?
Second.
Motion by Commissioner Rogers, second by Commissioner Friend. Any questions or comments? Please vote.
Motion passes 7-0.
Next is citizen comments for the Board of Equalization. Is there anyone in the chamber or on Zoom wishing to speak to the Board of Equalization about an item not on the agenda? Seeing none, we do have 3 resolutions, D, E, and F. There is no need for executive session. So do we have a motion for D, E, and F and adjourn? Motion by Commissioner Rogers, seconded by Commissioner Friend. Any questions or comments? Please vote.
Motion passes 7-0.
We will now move to the Douglas County Board of Corrections. Roll call, please.
Commissioner Boyle. Commissioner Kavanaugh. Commissioner Friend. Commissioner Garcia. Commissioner Morgan. Commissioner Rogers. Madam Chair.
Present. Item 1, approval of the minutes of the Board of Corrections meeting held Tuesday, January 11th, 2022. Is there a motion to approve?
So moved.
Motion by Commissioner Morgan, second by Commissioner Rogers. Any questions or comments? Please vote.
Motion passes 7-0.
Next are citizen comments for the Board of Corrections. Is there anyone in the chamber wishing to speak to the Board of Corrections about an item not on the agenda? Seeing none, we will move to the report from the Director of Corrections. Good morning, Mike.
Good morning, Commissioners. Michael Myers, Director of Corrections for Douglas County. You have before you my report for the month of January. After the 7th month of our fiscal year, we are $808,713 under budget. $595,694 was spent on overtime in January. This is a dramatic increase from previous months. We experienced an unprecedented number of staff out with positive COVID cases. We were also forced to open our closed housing units due to having nearly all of our 30 housing units on a quarantine status, increasing our staffing requirements. Thankfully, our positive cases among staff declined sharply towards the end of the month, and we expect to have much reduced overtime costs in February. Enclosure number 2, community corrections and reentry services. The 24/7 sobriety program placed 78 individuals on the program. There were 2,938 breath tests completed. 8 were positive for alcohol use, and there were 13 no-shows, and the compliance rate was 99.9%. 51 individuals were monitored for a total of 1,322 days of SCRAM monitoring. There was 1 no-show and 1 tampering violation and 2 alcohol violations. The SCRAM compliance rate was also 99.9%. We administered 932 drug tests with 127 violations. And there were 24 drug testing patches submitted for testing with 2 violations. Work release admitted 13 individuals due to COVID becoming present in our community corrections building for the first time. Work release transfers were paused for approximately 4 weeks, beginning with the final week of December. House arrest admitted 60 individuals. The reentry assistance program admitted 16 individuals, and again, they had the same COVID pause that work release did. And programming was converted to virtual formats because of the COVID situation. In reentry services in our therapeutic communities, there were 7 in the jail. There were 72 individuals admitted. 1 individual achieved a GED. And again, due to COVID, programming in the jail was also converted to virtual formats. Pretrial services. We continue to provide regular information to the courts regarding candidates for bond reduction and early pleas in response to the pandemic. 18 individuals were referred for priority prosecution, saving 70 bed days. There were 312 individuals placed on pretrial release. There were 1,271 individuals managed on pretrial release with a 91% compliance rate. 20 individuals visited the law library. This is a reduced number due to the COVID restrictions we implemented. Interviews for our pretrial release specialist positions are being conducted. This is the new frontline position for our enhanced pretrial release program in preparation for our launch, planned launch, on April 1st. Enclosure number 3, compliance. Pardon me. Regular documentation continues to be completed for all of our compliance processes. As our ICE contract concluded in January and our and our last ICE detainees were transferred out over the course of the month. We are currently preparing for our upcoming Prison Rape Elimination Act, or PREA, audit, which will occur over the summer months. Enclosure number 4, personnel. 7 officers and 1 sergeant left employment in January. A portion of these were to other public safety agencies. 10 new officers actually began training yesterday on February 7th. 3 officers were promoted from CO1 to CO2 in December. Several staff were presented with awards for meritorious service in January. And I'd like to recognize Lieutenant Ernie Black and Officer Thomas Belton, both of whom I've worked closely with for many years because of my background in community corrections. They both celebrated their 25th anniversary of employment with corrections in January, which is an amazing accomplishment given the rigors of this profession. Turning to enclosure number 5, population. There were 1,221 admissions. There were 1,229 releases. Our high count was 1,169, and our low count was 1,040. Our average daily population was 1,107. That is virtually identical to the previous month. There were 95 custodial bed sanction days. The U.S. Marshal population decreased. As I alluded to earlier, the ICE population decreased to 0, and you'll no longer see them referenced on our reports. Our felony pretrial population increased slightly. The misdemeanor population increased slightly. Probation violations remained stable, and the female population increased, and we operated 4 female housing units throughout the month. Enclosure number 6, medical. There were 967 intake screenings. There were 298 health and physical assessments. Inmates were sent out 17 times for emergent medical care. 5 of those were by 911. There were 4 hospital admissions, which resulted in 17 combined days of hospitalization. Enclosure number 7, mental health. There were 140 initial psychiatric assessments. There were 59 initial mental health assessments. There were 82 mental health infirmary placements, and there were 151 individuals placed on drug and alcohol withdrawal protocols. We had 1 referral to the Board of Mental Health and 1 referral to a long-term psychiatric facility. Other noteworthy items: we continue to respond to the COVID-19 pandemic. We had 44 confirmed cases of COVID-19 among the incarcerated population in January. However, the actual total was probably many times higher. We had positive cases in 28 of our 30 housing units in the jail, and both living areas in community corrections had positive cases as well. We continued to test symptomatic individuals and those who were going to court. There are simply not enough resources, both staff or testing supplies, to test everyone in custody. We assume that many of the individuals housed in units with confirmed positive cases were also infected. It was necessary to keep our staff and testing resources focused on testing those who were becoming ill and those who had court appearances. A staggering 95 members of our team missed work due to positive COVID tests during January, myself included. I want to publicly thank my leadership team and all of our staff who pulled together, worked long hours, and maintained the safety and security of our facility during yet another very challenging time. Approximately 75% of our staff have been vaccinated. During February, with the assistance of the Douglas County Health Department, and you may recall we switched from doing the Johnson & Johnson to Moderna right before the end of the year. Our data looks a little different now. We administered 99 first doses of Moderna, 3 second doses of Moderna, and 41 booster doses of Moderna during February. As of February 1st, we have fully vaccinated 1,532 incarcerated individuals and provided 42 boosters. Federal vaccination mandates that could apply to our staff appear to be in legal limbo at the moment. We continue to encourage voluntary vaccination among our staff and our incarcerated population. We implemented an N95 mask requirement for all of our staff while on duty on January 5th, and that remained in effect throughout the month. And we will probably this week take a look at giving individuals, our staff, the option of wearing a surgical mask while on duty if they're vaccinated. We have gone from, we had 51 staff out at once due to COVID earlier a few weeks ago, and we are now down to 3. So we are in a much better position than we were. Our body-worn camera project should be implemented prior to April 1st, with full implementation shortly thereafter. Soon we will be among the first correctional facilities in the United States to have outfitted our entire department with body-worn cameras. This will improve safety for our staff and provide greater transparency to the public. Our winter staff appreciation event, which has been rescheduled twice, will hopefully be held within the next few weeks at a date to be determined should our COVID situation continue to improve. With that, I'm ready for your questions.
Very good. Commissioner Kavanaugh?
Thanks for this, Mike. Following up on some of the findings in your report, the average daily population, you say, is kind of stable month to month over last month
Correct.
at 1,107. How does that look year to year? You know?
Last year was different, and I can't tell you why. Last year, for some reason, we were much higher this year than we had been in previous years.
Okay. That's fine. I mean, I just was
But
wondering.
historically, this is typically our lower point of the year, of our
Right.
cyclical year, and we're pretty consistent with where
Right.
we've been, with last year being an outlier.
Thank you. Minority majority population remains high at over 60%. That's been pretty consistently over 60% for a long time, right?
Yes, it has.
Regarding the staffing and personnel, and they're kind of in two different sections of the report. It might be better if they were combined, but on page, I believe it's 7, where you have the staffing numbers relative to authorized and on-hand personnel, it indicates that particularly in the core corrections officers cohort, 349 authorized with 292 on hand, or 83% staffed, for an overall authorized 492, on hand 423 for 86% staffed. And, you know, like I said, I don't know why that's broken out differently than personnel, but might be something to look at going forward. The county has now hired a diversity officer to look at diversity in our staff and personnel. Do you have any idea what that breakout would be, like we have on the census population?
Absolutely. Well, I don't want to quote you the numbers off the top of my head in case I get them wrong.
Right.
But we track our staff demographics in every way, shape, or form, I think, that we could. And I'd be happy to bring that to the board next month.
That'd be great, just to give us kind of, you know, same as we do on the census population.
Absolutely.
On the COVID front, and I tried to catch this as you were speaking, but you indicated that 95 staff had tested positive. Is that over the life of the pandemic from like March of 2020 till now?
No, that was in the last month.
95 in the last month.
That's why it was it was a rough month, Commissioner.
Wow.
It was a very trying month, but yes.
And, you know, we hear this from the health department relative to how they track populations that are testing positive who have been vaccinated and populations that are testing positive who haven't been vaccinated. These are called, I think, breakthrough cases.
Sure.
Do you tabulate that information?
We have that. Again, that's a number I don't have with me, but I could bring that. There was a significant number of breakthrough cases that occurred among that group because, like I said, we have inched up to about 75% of our staff being vaccinated. So if when you have 95 cases, you're going to have some breakthroughs among that. And, you know, unfortunately, there's two sides to this coin. Fortunately, very few people had significant illnesses as a result of being infected. Unfortunately, the Omicron variant, didn't respond well to our previous efforts, to mitigate and slow spread that worked in previous outbreaks. Didn't work so well this time around.
Okay. If you could, along with the majority-minority breakout on personnel, get us that breakout as well, that'd be great.
Yep.
Thank you.
Commissioner Boyle?
Thanks again for that presentation, Mike. Just a couple things. Whenever you come and speak to us, it always amazes me, or I guess draws my interest about how many of in the statistics that the general public doesn't get to see, how many of the corrections population are in there and due to like social determinants of health, like homelessness. So one thing, the statistic that's in here is that about 18% of the population of the correction center actually are homeless. And so we talked at one time before about how do you send someone on home release when they don't have a home to go to. So I think it's really important that we stay aware of really those types of needs in order to get these folks stable once they are released, so that they don't come back simply because they don't have a condition like that. So also you mentioned about drug and alcohol withdrawal protocols that people are undergoing, and then of course there's the mental health aspect, where looking at the statistics in here, 39% of the inmates have some type of psychiatric diagnosis. 39% of the inmates have a psychiatric diagnosis. That's over a third of that population. 12% have some type of psychosis, like schizophrenia. Those are the dangerously mentally ill, dangerous to themselves or to the community. 12%, that's just a huge, huge number. So when we think about corrections, we also have to think about these types of conditions. It's not just punishing or incarcerating someone because it's something they did and they'll be back out functioning in the community. These people are truly have other things going on. So I think more than anything, I just want to make the point that as a board, we need to continue to address these issues, and that to address those people who have those types of conditions in the jails, it's not only cost effective because we avoid the recidivism, but it truly is the right thing to do. So more than anything, I just wanted to make a statement to that, and then see if you have any insight or any additional comments.
Well, regarding the homeless issue, we've known for many years that we are the de facto third largest homeless shelter, in the Omaha metro area, and we do have, safety and security is our first and always will be our first mission. But we have many missions, and some of those missions I wish were borne by other people in other places besides the jail. But when the individuals are presented to us with the issues that they have, we have to do the best that we can to treat their conditions, to try to set them up to be successful and connect them to resources upon their release. And another important thing for the community to realize is that 90%, probably well over 90% of the people who are brought into our jail are released from the jail. They're not going to prison, they're not going away, they're not being deported. They're coming back out into the community. And that just drives home the point that you were making, that we have to get to the causes of this on the outside of the jail to stop that cycle of incarceration and homelessness and potentially victimization of innocent people as well.
Yep. Thanks, Mike.
Mike, when you said there were 7 officers and 1 sergeant that left employment in January, and then a portion of those to other public safety, what's a portion mean?
I had a couple of those that went to other agencies.
Just 2?
I believe so.
Okay, all right. And then I'm I lost my other question now. Well, I'll just make my comment because I can't find my question, but, you know, everyone on this board respects what law enforcement does as responders to law offenders. I think it is, and this is testament of the good work that you all do, which I think is sometimes even harder work because you're there 24/7 with individuals who are very needy individuals at times. And so now you throw COVID on it, it even exacerbates the issues that you have to deal with. And so just so staff knows, please go back and tell them how proud and thankful we are of the work that they do, especially during these trying times. We didn't have what could have been disasters over there during all of this.
Right.
And we're very proud of that and thankful for that. So just wanted to make that comment to you. So thank you.
Thank you. I appreciate that. We do have amazing people that do amazing work.
Yep,
and
that's
they've
right.
stepped up time and time again.
Yep.
During these past couple of years.
All right, with that, no need for executive session. No further questions or comments. Is there a motion to adjourn out of Board of Corrections? Motion by Commissioner Rogers, seconded by Commissioner Friend. Please vote.
Madam Chair, this also serve as
Oh,
reconvening
and
as a Board
go
of
back,
Commissioners.
yeah,
Okay.
reconvene as Board of Commissioners.
Alrighty.
Yep, thank you.
Motion passes 7-0.
We'll move to the agenda for the Douglas County Board of Commissioners. Roll call.
Commissioner Boyle? Here. Commissioner Kavanaugh? Here. Commissioner Friend? Here. Commissioner Garcia? Here. Commissioner Morgan? Here. Commissioner Rogers? Madam Chair.
Present. Item A, approval of the minutes of the Board of Commissioners meeting held Tuesday, February 1st, 2022. And item B, approval of claims submitted for payment processed through Tuesday, February 22nd, 2022. Is there a motion to approve A and B? Second. Motion by Commissioner Rogers, second by Commissioner Morgan. Any questions or comments? Please vote.
Motion passes 7-0.
Next is the consent agenda, items A through D. Is there a motion to approve? Second. Motion by Commissioner Rogers, second by Commissioner Morgan. Any questions or comments? Please vote.
While you're voting, I'll just clarify, item C1 was removed from the agenda.
Oh, yep, thank you. I missed that. Thank you.
Oh, give me a second, I'm sorry. Okay, thank you. Motion passes 7-0.
Next are citizen comments. Is there anyone in the chamber wishing to speak to the Board of Commissioners about an item not on the agenda?
If I can get this on. There we go. Commissioners, my name is Andrew Sullivan of 7748 Western Avenue. I continue to try to bring information to the board about COVID and my perceptions. I think we need to screen this back a bit so we could see this. My biggest concerns over the entire COVID crisis is I think we never really identified the properties of COVID as an airborne virus. all the mitigation efforts that I've seen basically don't treat it way. They think it's like smallpox, polio, typhoid, but none of those are airborne viruses. Flu and measles are. What it means for an airborne virus, it means you can go into a public restroom or public bathroom, be there for 5 minutes, and pick up an airborne infection from someone that had been there an hour ago. And that's why a lot of this mitigation kind of has flaws, why you got breakout cases, why you got people getting infected and people getting infected in situations where they don't know where they got it. I recommend using a temperature scanner. You can get these at freestanding, you can put them in events, you can make it mandatory for employees, you can put it anywhere. The great thing is, fever is proof you have a symptom of something. And if you can give people that information, they have the ability to act on it and tell everyone else, hey, I just found I had fever and we were out last night. Maybe we shouldn't go to this next meeting, or maybe we shouldn't go out, or get tested, or do whatever needs to be done. But we're not giving the public that information. The benefit of this type of scanner, and there's some that there are all types of of these, you can scan 1,000 people in a matter of a few minutes. It's so efficient. There's nothing polarizing it. People get the information. They love to know, geez, I'm okay. Or, oh, I have a little bit more than a headache. I gotta go call my doctor. We don't do this. But literally, you're talking about events, basketball, and all this stuff coming forward. This could scan 1,000 people easily. And if you have an event with 15,000 people and you find 15 of them have something, guess what? You've isolated actual illness. People are dismissive of symptoms, assume they have allergies, a tension headache, or hangover, but fever draws their attention for medical assistance. Even vaccinated people can come down with illnesses, including COVID or merely the flu. Who knows? This helps. On a different matter, slightly different, one of the things I would like to see the county do is plot the outbreak cases on a timeline, as is done with vaccinations, cases, and deaths. Currently, the outbreaks are only compared to the total of vaccinations, which is not helpful to me. Since I spoke to this board 2 weeks ago, 7,000 breakthrough cases took place in the county, and I can only wonder if this reflects high vaccination rates from 10 months ago. In some cases, I suspect this is just may be a batch of bad PCR tests that are out there. One other thing, you're going to hear people refer to unvaccinated. I'd be careful with that word, because some people have already gone through COVID and been told not to get the shot. There are some people that took one shot but had such a reaction they didn't get the second. There are some people that got all three, but they got sick 2 days after and got COVID and are marked as unvaccinated. So a lot of that is kind of blurry, and you should be aware of that. Anyways, thank you for your time.
Thank you, Andrew. Anyone else wishing to speak to the board? Good morning.
Good morning, Commissioners. Chief Deputy Wayne Hudson, Douglas County Sheriff's Office, 3601 North 156th Street. Last week, I came before this board with the resolution, and inadvertently, there was a name left off. So what I would like to do is read the updated version into the official record. Whereas Mr. John Solano started his career with the Office of Douglas County Purchasing on February 11, 2013, serving as the garage supervisor. And whereas during his 8.8 years of at the Douglas County Garage, Mr. Solano supervised the highest standards of vehicle build, quality, and readiness the Douglas County Sheriff's Office has ever enjoyed. Whereas Mr. John Solano, with the assistance of Dustin Harris, Tim Liddick, Randy Nickel, Joel Nicola, Robert Venemus, and Rick Hanna, was at the forefront of the metamorphosis of the Douglas County Sheriff's Office vehicle fleet from that of a basic no-frills employee transport system to one of the highest recognized brand. Whereas the Douglas County Sheriff's Office relies on highly functioning vehicles to respond to emergency calls for service from the public. Whereas the Douglas County community benefits from the operational ready equipment utilized by the Douglas County Sheriff's Office employees to consistently deliver their premier law enforcement services to the Douglas County Omaha Metro. Now therefore be it resolved by this board and the county commissioners, Douglas County, Nebraska, that Mr. John Solano, Dustin Harris, Tim Liddick, Randy Nickel, Joe Nicola, Robert Vitamis, and Rick Hanna are thanked for their service to the Douglas County Sheriff's Office. Dated and signed by the Chair, Mary Ann Borgeson.
Thank you.
A couple other items, since I still have time, is you were talking earlier about corrections numbers, and I know you can't speak back because it's open mic time. But as far as the Sheriff's Office, we've had 34 positive COVID designations in the last 45 days. That's the Sheriff's Office. The other thing I want to call the board's attention to was recently Sheriff Wheeler authorized Dr. Justin Nix to perform a citizen satisfactory survey on the Sheriff's Office. Those results are now posted on our website at the bottom at omahasheriff.org. I think this board and the public will be highly appreciative of the job that we do. The numbers are outstanding. I'm talking 95% of citizens say that we're doing a good to an excellent job in providing law enforcement services to Douglas County area. So I encourage the county board to go out to the website, download the report and review it. And when you see a deputy in our office, like Deputy Benson here, who's here every Tuesday, thank them for the service that they do. Thank you.
Thank you. Anyone else wishing to speak to the? Thank you. Anyone else wishing to speak to the Board of Commissioners about an item not on the agenda? Sorry.
Hi, my name is.
Good morning.
Hi, my name is Linda Davis, 10215 West Center Road, Omaha, Nebraska. I am here in joining with Paul Bellinger at that residence. I have some paperwork I'm going to give to Dan Ash for all of you to read. It's regarding a petition for a special permit for use for some structures that we have in our front yard that the city has cited Paul against for a permit that one of them is a water collection. I'm coming to you guys because we've been to the city. The city has rejected the permit we put forth. They have told us there's no workable solution. It's kind of twofold, the structure. It's a water collection for our irrigation planting that we do, vegetables, and the state has said we do not need a permit for that. Also, there is another structure for a noise abatement. We live on Center Street, 102nd and Center, lots of semi-traffic and big commercial vehicles, 40 miles an hour. We have an accident almost every day, someone ending up in someone's yard. The structure that is, both structures are a noise abatement. And so Paul has done a lot of work. We've tried to come before this board before. He has a court date, February 25th, on the site, 3 citations that will probably get a fine, possible jail time. We are just trying to protect our house and the houses around us. Our neighbors experience the same abuse every single day. We're woke up by the home shaking, the loud noises because of the truck traffic and the road structure, potholes, etc. We've been around for a year, so I just wanted to give you this information to review. Like I said, his court date is February 25th. He's looking for a special permit from you guys to continue with the noise abatement. So if you can just review this, that'd be great, and get back to him. The court notice is in here for the date and time. His attorney's name is at the bottom if you need any more information on that. Thank you.
Thank you. Anyone else wishing to speak to the Board of Commissioners about an item not on the agenda?
Good morning, Larry Storr, 5015 Lafayette Avenue, Omaha 68132. Had me worried there for a couple of minutes. I thought my status for removal was upgraded with the presence of Mr. Hudson. I'm going to talk about some legislative issues, yes. but I may not get the opportunity at the end of the agenda today to talk about the legislative issues that are on your agenda because it's not spelled out. These are legislative issues going on right now down at the State House on the floor, debates about TIF financing. And the reason I'm bringing that up is we seldom hear that debate in these chambers because it's always the city. However, the city is within the county, and both bodies influence the legislature more than I do. And this week is probably, or next week, is probably that time of year where the legislators in both bodies run to these national associations of counties or municipalities or this or that to find out what the agenda for next year is, to limit citizen involvement. But anyway, enough on that. Today, right now in River City, well, not River City, it's down in Lincoln. The chairperson of the Urban Affairs Committee has the majority of the floor today in regards to TIF financing. And I'm just going to do a quick rapid round here because I know I don't have a lot of time. LB 713, 1060, 836, 725, and 798. All having to do with TIF financing, which kind of affects me because now they're creeping up on single residential properties. They might pick my house out of the block where I live and say my property is blighted. 39th and Dodge is an example of this. A vacant lot there. It used to be a travel lodge. Right in amongst a lot of nice old historic houses, by the way. It's now blighted and up for discussion. It's already been approved probably. Yeah, we get to go to the meeting and hear about it, but they vote for it anyway because it's already approved. It's a slam dam, thank you ma'am thing. But the legislature says, you know, the Constitution of Nebraska says you should pass no special laws. However, tonight we're all under an emergency, so everybody's rushing to get the money, either state money or TIF money or federal ARPA money. At some point, that's going to run out. Now we have a term called micro TIF down there in Lincoln. But Mr. Wayne used to be here. Single-family dwelling projects even now. You're increasing the dollar amounts for which things will qualify for special TIF breaks up to $250,000. Oh, that's maybe more than my house is worth. Isn't that for special people? It allows a vacant lot to qualify for an expedited review. Within a substandard and blighted area, corporate limits, etc. Change from 10 to 15 years, correlating with the 15 years defined in the state constitution. Proof of the governing body. Yes, ma'am. A mechanism to remove blighted or extremely blighted designations for areas that no longer qualify. No such mechanism currently exists, so it goes on and on and on. Authorizing municipalities to use under the guidelines to establish goals, et cetera, et cetera. But yes, we're under an emergency, so we need to do this and do this right now. We need to rush for getting more TIF projects approved through the Planning Commission before the emergency ends, and increase everything, tax breaks for 20 years, ad valorem taxes.
Thank you, Larry.
Yeah, thank you.
Thank you. Anyone else wishing to speak to the board about an item not on the agenda?
Good morning, Commissioners. Dave Forrest, Planning and Zoning Coordinator, Douglas County. I wanted to take a moment just to draw your attention to an example of an action that you took that might appear to be small on the surface and maybe it escaped your notice. But several weeks ago, you passed a resolution that requires additional exits, lighted approved exits in agricultural buildings. And I am not saying that that requirement would prevent future tragic situations like the barn fire we recently had. But it was a smart move and it was the right move. And I appreciate it. Thank you.
Thank you. Anyone else wishing to speak to the Board of Commissioners about an item not on the agenda? Seeing none, we will move to our presentation, the COVID-19 update and COVID-19 vaccination plan update, presented by Dr. Lindsay Hughes. Good morning.
Good morning. What did I do with you? Thank you. Isn't Miss Cole great?
She knows her way around that computer, doesn't
Yes, she does. I should know my way around it better than I do by now. Well, good morning, Commissioners.
Good morning.
It's a pleasure to be here this morning and share some good news with you. That's always nice. We are currently still experiencing high levels of transmission in the community in terms of COVID-19, but I'm very happy to report that we continue to have a very steep decline in cases currently. 361 is where we are currently sitting at per 100,000 for our 7-day total. So we are making wonderful progress in the right direction there. Very, very happy to see that. Unfortunately, we did add 33 deaths since last week. And that's, just to be clear, those deaths did not all occur last week, but we received those death certificates over the past week. So that's quite a high number, even for what we have been seeing. That's not necessarily a surprise because hospitalizations and deaths do typically lag what our case counts look like, and we were quite high there for a while. So it's not necessarily a surprise, but I think it does underscore just the severity of the continuing situation. Last week, I think we were sitting at 999, and so we did unfortunately surpass that 1,000 benchmark. All right, in terms of cases and who we are seeing with COVID currently, of course, this overall number has decreased. And so really we're seeing a decrease across all age groups in terms of who is testing positive right now for COVID. So that continues to be great news. Our pediatric population, so under 19, continues to be the highest proportion of cases that are testing positive currently. That is followed closely by young adults. So that hasn't really been too much of a change. It's just that our overall numbers are decreasing, so this is all somewhat compressed. I'm also very happy to report that our overall hospitalizations are also decreasing. Our hospital capacity has been below 85% for 3 days now. So today, or last night, with the report that came out, we were at 83%. The day before that, I think, was 84%. So that also is going in the right direction. And you can eyeball that trend on this particular chart. You can kind of see, if you kind of look through the middle of these jagged lines, that is starting to come down. I'm very happy also to report that there are some decompression efforts that have happened with the hospitals and in conjunction with the Hospital Association and DHHS. So they have essentially been able to create some locations for those who have been sitting in the hospital and not had a place to go to actually go until they can find placement. So that would be those who are trying to get into a skilled care facility. I think some of those were also potentially behavioral health level hospitalizations that needed a higher placement than just being released back into the community and just waiting for beds. And so there's basically an effort to open some additional units that can accommodate that and take those people out of the acute setting so that capacity has some more breathing room. So that just occurred last week. So we're very happy to have that environment now functioning. And then if you look over on the left here, this blue line, you'll also see this is the number of hospitalizations, and that's dropped as well. So that's great news. Our ventilator usage has also dropped. So that's this yellow line. We finally got out of the 40s this week, so we finally dropped down to 33 people on a ventilator, so that's also great news. Hopefully, as our numbers continue to decrease, we will continue to see these trends continue. I do still want to emphasize that COVID is still very much alive and well in the community. We still continue to have people hospitalized. In fact, right now there are 342 people hospitalized in the metro with COVID, and 14 of those are pediatric patients. 57 of those are adult ICU. So certainly we're still seeing some severe illness out there. So we need to continue to be vigilant and be careful, but happily we are perhaps getting a little bit of breathing room with this soon. Actually, let's go to this one. So test positivity, number of people testing has dropped somewhat, but our overall test positivity has also dropped. So that moves along with those trends that we're already talking about. So if you recall, we were up close to 30% and we've dropped down to 15.9, so basically 16% test positivity. So that number as well is going in the right direction. So breakthroughs, you're going to continue to see that to grow just a little bit. Happily, it's growing slowly, but we do continue to see breakthrough cases, and we'll talk a little bit more about why we're seeing that here in just a moment. 9.1% of the cases that we're seeing currently are breakthroughs. So that is up a bit from last week, and not surprisingly, because we still have a number of people who haven't been boosted, and of course the Omicron variant is more transmissible and slightly easier to evade that vaccination if you just have that initial series. So that's not surprising. We know that this continues to go up, and then as people get their boosters, that will hopefully slow. Deaths from COVID in our vaccinated population continues to be very low, so 0.028%. That has remained pretty stable throughout, so that does tell us that the vaccines are still doing a good job of preventing that very severe illness and deaths. We are continuing to vaccinate as much as we possibly can. You can see on this particular slide that the number of people coming in to get those vaccines has fallen off some. So we had a nice spike, and now it's kind of slowed to a trickle somewhat. So that has happened, but we are continuing to hold a number of clinics throughout the community, working with our partners throughout to make sure that we are reaching everyone we possibly can with these vaccines. In terms of being fully vaccinated, currently of those eligible, about 71% are fully vaccinated. So we're continuing to make some progress there, which is wonderful. Out of all residents, 65.7%. So of course, we still have some people who can't be vaccinated there. So our very small children, 0 to 4 years old. So those are included in that number. And of course, they can't get the vaccine. So 46.3% of our residents have had a booster or third dose, and that's over 12 because that's who boosters are currently approved for. So we continue to have clinics at schools, at other areas in the community, and hopefully continue to get vaccinations into people. So we are currently awaiting just official word of approval for that young population. The basically 2 to 4 year olds, I think is what we're waiting on right now. And so we will be prepared to assist with that. I think a lot of pediatricians will likely be the ones that are administering that, just because you need a little bit more of a clinical setting to really effectively see those patients. Dealing with little toddlers can be, as you can imagine, can be a little bit difficult in a public setting. So we just try to be a little bit more sensitive and careful with the environment that they're in. And so pediatricians hopefully will be doing some of that, and then we will, of course, offer it as we are able to. So just to be aware of that. And then in terms of testing, so there's been a lot of conversation around the home tests. So the federal program is ongoing, where people are able to call and get free tests essentially sent to them directly from the federal government. We also will be receiving a number of tests from DHHS. We're very grateful for this. And basically, we will be sharing those with some of our community partners, and then a number of those will also be available for public. So we don't have every location set in stone yet, so we haven't put that information out, but we're working on that, and it'll be out soon. So people will be able to basically find what public place that they're able to go to pick up tests. So we're working on that, and hopefully we'll be able to get some more home tests into the community so that people can at least test to know their status. And other than that, I think I am ready for any questions that you have.
Commissioner Kavanaugh?
We appreciate the update. The deaths from COVID in the vaccinated population that you mentioned, I don't know if I heard an actual percentage of that. I don't see it on the deaths portion of the dashboard.
So for breakthroughs, is that what you're talking about? So people who've been vaccinated?
I'm talking about people who are vaccinated who died.
Yes. We've had a total of 103 out of the 374,000 that are fully vaccinated, which comes out to 0.028%.
So of the total population of 1,024 who have died in Douglas County, 103 of those were vaccinated people?
That's correct.
That's right?
Yes.
Thank you. Do you know if those percentages are generally in line with national percentages for the same category?
I think so. It has grown very slowly and not a lot, but we don't seem to be having any trends here that aren't consistent with what other places really have seen with this.
Right. So, we've talked about this before in terms of the positivity rate, and I appreciate you bringing us this number, but on the test positivity page of the dashboard, it's a little difficult sometimes to determine exact percentages because it's a graph that doesn't give exact percentages, but it has actually two ways of calculating. And I know we've talked about this before, but so the public isn't confused. The first graph there, weekly percent of positive cases, people over people method, appears to be about 50%.
Yeah.
And the second one, weekly percentage of positive cases, test over test method, appears to be approximately, I think you said 15.9%. So, again, to avoid confusion with people, What's the difference between one graph that says 50% positivity and one graph that says 15.9% positivity?
Great question. So these are two different methods that have been used to calculate, and we really don't report the people over people method so much because it really ignores reinfections. So it was a good metric early on in the pandemic to look at. Really, people over people only counts a person one time. So if you've been positive, let's say you have caught COVID 3 separate times, you're still only counted once as a positive test under the people over people method. Of course, as we've gone through the pandemic, we know people test more than once, people have been reinfected. Test over test is really a better picture of how much COVID is actually circulating and being picked up. So the test over test counts every test that's been done, regardless of how many tests a person has had. So what happens there is your people over people method has a smaller denominator that pushes your proportion up essentially. And that's why you see kind of that difference where this people over people method always looks a little bit higher than the test over test. But test over test is really the more correct and the more common way that public health reports these.
1 minute.
And I appreciate the news that you bring us regarding the numbers going down. And the first summary page of the dashboard shows a dramatic decline in the 7-day total number of cases per 100,000. There, they talk about 361. I think you mentioned 351, or is it 361?
361.
Okay. And that's dropping like a rock, which is really good. And then in the hospital category, I think you indicated that we're at, is it 83% occupancy full?
Correct. As of last night, it was 83%.
Right. And these are important metrics because they're tied to, all kinds of policy. For instance, I think that you have
Time.
We'll come back.
Commissioner Boyle.
So thanks for all the information. Once again, just a few questions. One is, it is nice to see hospitalization be freed up just a little bit. And so I can feel it at the institution where I work too. So the beds are still full, but you're not feeling like, it feels like the patients are able to get some of the care that they need in most cases. So I think that's the thing. The ERs are freed up just a little bit more for the other non-COVID types of things. The question I have is, I know that some of that is due to the decompression efforts, where we take patients who have been in the hospital for a long time and may not need to be in a hospital setting, and we've got them transferred to other facilities that don't have quite the acute care. Do you know how that has affected the percentage? Like how much of the drop is a result of those patients being moved out to other facilities?
I don't know that just yet, but I have some meetings upcoming with Hospital Coalition and leaderships that I can find that out. We don't know for sure. I don't know how many from Douglas County have been sent to those settings. I'm not positive at this point. I know it has helped a little bit, along with lots of other efforts to stem the flow here, but I can find that out for sure.
I was just curious. And then as far as, obviously a lot more people are getting COVID, and I think that we all know that when you get something like that, it gives us a sense of, just like when you get vaccinated, that you might be protected down the line. Do you have any statistics or just the thought about once you get COVID, does your immunity boost? And if so, do you have an idea how long?
It does. So you do have some protection for a time after being infected with COVID itself and not through a vaccine, which is great. However, that immunity really depends on the person. So it's not always consistent. We estimate it's about 3 months. So if you think back to when we were recommending vaccine for the first time, we really wanted people to wait about 90 days after an infection to go in and get their vaccine. I was one of those people who had to wait 90 days after my infection to get my vaccine. So there is a time where immunity is pretty good. However, some people drop their immunity very quickly. Other people may maintain it a little longer than those 90 days. It's really dependent on the person, and it's a pretty wide time frame, which is why we encourage vaccination, because it's just first of all, getting a vaccination is much safer than getting COVID and wondering if you're going to be one of those very severely ill people or even potentially die from it. And it also is more predictable in terms of the length of immunity that it provides. We know it doesn't provide perfect immunity, and we know that you need a booster. So of course, none of this is perfect. It's just more predictable, and when you're talking about how to manage this at a public health level, it's just very important to know that you're going to have some predictable immunity. And of course, you want to have predictable immunity. And so that's why we continue to encourage those vaccinations, even though we do know that, if you catch COVID, there is a time where you are going to have some immunity to that.
So just to jump right back on that, with vaccination, we know it does also provide immunity, which can vary person to person. Do we have a general idea how long that is yet? I know studies are still out there.
So, it's a good question, because now Omicron is our predominant variant, and so I think that research is still ongoing, but generally about 5 to 6 months, depending on the person. And that's why that booster becomes so important, because we know that the immunity starts to drop off more significantly at that time frame, and that booster really drives it much higher.
And I think the point to drive home is just that being immunized.
1 minute.
Being immunized does decrease the severity of disease, so you still will get it, but you may not end up dying or being hospitalized as a result.
Absolutely.
And then do we have any data on the long haulers at this point?
Not predictable or reliable information yet. I know that is something that's ongoing, that people, researchers are actively looking at the number of people who have kind of these long haul symptoms, how long that lasts for, what that actually looks like. It's been a pretty variable situation as well. So that data collection is ongoing as well.
All right, and then last thing, BA2, the new variant, any word on that?
It's out there. So the BA2 variant is that subvariant of Omicron. It's still Omicron. It looks like it could be slightly more transmissible than Omicron, like mother Omicron. But at this point, it is not being considered a variant of high concern.
Thank you. Commissioner Kavanaugh?
Coming back to the two metrics of the number of cases over 100,000 and the hospitalization percentages, I got an inquiry from a constituent about why are these important. I just thought you could elucidate on that.
Sure. So hospitalizations are important because this is really a picture of the severity of illness that we have occurring in our community, and our healthcare capacity is an extremely important infrastructure component that needs to be protected. Obviously, we have people who get sick, get injured, have multiple health issues happening every day, and if they're unable to get services, those can escalate and become much more severe. So it's very important that we're protecting our hospital capacity. But besides that, it does give us kind of a picture of the severity of illness that's happening in a community. In terms of the number of cases that we see, so that's this, you're referring to the 7-day total number of cases per 100,000. That is really a metric that shows also what's happening in terms of community transmission. It's not perfect, so this is dependent on how many people are actually testing for COVID, and we know not everybody tests. We know some people do home tests, so those are not always reported. So, but this is basically a proxy. It's a good way to gauge really how transmission is going in our community, and that's actually a metric that's used by the CDC and other states to gauge their transmission in their communities. So that is why we use that so much in our own considerations.
And my constituents specifically asked those metrics, and I'm glad to hear that we're following the CDC guidelines on this, tied into mask policy.
They are, yes.
Those are the metrics that are in the mask mandate. When we reach a certain point, what are those numbers? 200
for the 7-day total per 100,000, and then 7 days at or below 85% for hospitalizations.
At or below, I'm sorry,
80, but at or below 85% for hospitalizations.
okay. And it's the 100,000, is that in a day or in a week or what?
That's a 7-day total, so it's over a week.
So they're both 7-day kind of things?
Correct.
Right. And we're moving into that range, it looks like.
We're getting closer.
Good.
We're very close. Yes.
Thanks a lot.
No other questions or comments? Thank you,
Thank you.
Lindsay. With that, we will move to our public hearing. We have a resolution to approve a special use permit to operate a major home occupation on approximately 2 acres of residential property, specifically firearm repair and gunsmith shop and firearm transfer service. The address is 18970 Rainwood Road. And with us today is Dave Forrest from our Environmental Services Department.
Good morning, Commissioners.
Morning.
Dave Forrest, Planning and Zoning Coordinator, Douglas County. I have Rod Helliker with me today, who's the applicant. He's seeking a special use permit, as you said, for a major home occupation for a gunsmith shop and firearm transfer service. We had a Douglas County Planning Commission meeting on January 12th. After advertising a notice in the paper and distributing notices to surrounding neighbors, and the Planning Commission unanimously approved that special use application, and it's here before you for your consideration as a public hearing.
The public hearing is open. Is there anyone here wishing to speak for or against this application or permit? Seeing none, I will close the public hearing. What is the will of the board? Motion by Commissioner Friend, seconded by Commissioner Rogers. Commissioner Boyle?
Yeah, just a couple questions. In reviewing the planning commissioning meeting, it says that there were some neighbors that expressed some concern about added traffic and that. And I was just wondering, just estimate as to the volume of customers that could possibly be involved in this
I
endeavor?
think I'll ask Mr. Helliker to address that.
Hello, I'm Rod Helliker. I live at 18970 Rainwood Road, and my business is FFL Transfers. I've been doing this for 3 years as a sole proprietor, and I'm switching to an LLC just for tax purposes and liability. It's a fairly small business. I don't have a lot of traffic. Basically, up till now, I've been doing a little bit of Cerakoting of parts for other businesses and stuff like that. I've done about 90 gun transfers over the 3 years that were internet purchases that they came to my house to pick up the gun and fill out the paperwork.
Okay, so it's not something where you're putting up a shingle and people are driving in and out. I'm not familiar with the area, I'm sorry, so.
We're like a rural, small community, about 100 houses. I'm on the south side of that. Do the business out of a shop in the back. We've got a gravel road, so it's,
Okay.
Kind of in the middle of my 2 acres. Not a lot of traffic.
And not a lot of foot traffic, it sounds like. It's mostly just, some of it's by mail or it's really, like I said, just the volume of people coming in and out of there doesn't seem to be very
really low
significant.
volume.
Okay, thank you.
No other questions or comments? Please vote.
Motion passes 7-0.
Thanks for being here today. Next are committees, the budget report as presented. And then we have HR, Human Resources, the weekly personnel report from Civil Service as presented. And then we have a couple, 3 legislative items to support. LB 805, it changes the provision relating to the prioritization of applications and intent to appropriate funds under the Noxious Weed Control Act. This is Senator Hughes. It's in the agriculture hearing, was January 18th, and I do believe Mr. Reed from our noxious weed control asked for our support on this. He is on Zoom if anyone has any questions. Is there a motion to support? Motion by Commissioner Rogers, second by Commissioner Morgan. Commissioner Kavanaugh?
I guess I'd ask real quick for the public's knowledge, what does this bill propose to do?
I just read that. So Mike, if you're on the line right now. Good morning.
Hi, good morning. Good morning, Board.
So do you want to just give us a quick synopsis of, I think it appropriates more dollars from 1 million to $3 million annually for the management of the vegetation. Is that correct?
That's correct. This bill would add language to an existing bill that's already in place. Currently, there's $1 million available for projects across the state for water conveyance projects to work in any flowing waters of the state. For Douglas County, that means Missouri River, the Platte River, the Elkhorn, and all the flowing tributaries in Douglas County. Currently, we have projects on the Platte River and the tributaries. And then at the last meeting, I had talked about the Lower Platte Weed Management Area receives funding through this funding is an appropriations funding through the legislature managed by the Nebraska Department of Agriculture. And so these funds are applied for by counties and these counties need to be organized as weed management areas. Douglas County is part of the Lower Platte Weed Management Area. So we have received funds from these appropriations every year since they've been available in 2016. And so these funds are able to manage for any kind of vegetation in the stream or the banks within 100 feet of those banks. And so that'd be including any noxious weeds or any woody species which would affect that stream flow.
Okay. Any other
Thank you.
questions? All right. With that, there is a motion and a second to support. Please vote.
Motion passes 7-0.
Next, we have another support, LB 911. This changes the grant amount for the 211 Information and Referral Network. This is brought by Senator McDonald, the appropriations hearing, February 2nd, and this changes the amount from $300,000 to $955,000 for those grant opportunities. Commissioner Kavanaugh? Oh, sorry, is there a motion to support? Is there a second? Motion by Commissioner Rogers, seconded by, was that Commissioner Garcia? And Commissioner Kavanaugh, did you have a question on this?
Just again, a quick explanation of what 211 information does and what this grant proposal would enhance their ability to do, I guess.
So 211 is the information and referral network where someone calls in to find out what resources on just about anything that they could potentially have a question about. And it provides grants. The eligible grant for the 211 information shall update the information and referral services on network at least annually. It gives grants to these established organizations and providers to be a part of the 211 network. And again, it's increasing the amount of those grants to these providers.
And this information is like government services information?
Yeah, somebody calls and says, who do I call for long-term care facilities? Who do I call for behavioral health? Where can I get food? It's the public who's calling in asking for those. And it could be community, not just governmental. It could be community providers as well.
Thank you.
And these are, grants are actually awarded by the Public Service Commission. Any other questions or comments on 9/11?
Paul Johnson's on as well.
Oh, yes, I forgot. Paul Johnson, our emergency manager, has asked us for supporting this legislation. All right. There's a motion and a second. No other questions on 9/11. Please vote.
Motion passes 7-0.
And I might just add real quick that the 211 network is also a part of the conversation that's going on with our 988 number that needs to be implemented by July 1 of this year, which is a line solely dedicated for behavioral health. They're going to be instrumental in resources for people who call in, and that is, again, continuing to work, and I actually will be bringing some updates on that after we meet again, so I'm pretty excited about that line. I know Commissioner Boyle and I have talked about that, very excited about that line being implemented, so.
Question?
On 9/11, we're going to move on first to LB 1089. This is the appropriate federal funds to the Department of Health and Human Services for licensed and Medicaid certified nursing facilities. This is Senator Stinner's of the appropriation, and the hearing was held on, or is on February 22. Aaron Nelson is here from our health center, but this basically is federal funds that were appropriated, and the state is going to appropriate $60 million of their federal funds to the Department of Health and Human Services, which is program number 348, which our long-term care facilities fall under, the nursing home facilities. And there's about $45 million to the Medicaid certified nursing facilities, and that's divided up by their formula that they have at the state level. So this actually would be a potential increase in revenue for our facility if this passes. And so we are asking for support on 1089. Motion by Commissioner Rogers. Second by Commissioner Morgan. Commissioner Friend.
Thanks. Thank you, Madam Chair. Marcos, can I ask a question about this? If you know the answer, great. If not, I don't think it's that big a deal. But when this was put together by appropriations, was this part of the Governor Ricketts's wish list or his proposed budget? I mean, do you remember it? And how? Because the governor did put a lot of the ARPA initiatives in his original budget, and I haven't read it yet. I mean, I guess what I'm getting at, Marcos, and we don't have a crystal ball, but what type of enhancement would he make? Or, I mean, this is probably veto-proof, right? Go ahead and guess. Feel free to guess.
Well, Commissioner, I would say 1089. I don't think it's veto-proof. I think that, that he could always come back and veto that bill if it did pass. I would have to check to see what mirrors, like whether his budget mirrors what's being proposed. That I don't know off the top of my head, but we can definitely go and see what mirrors. I don't know if Aaron knows any additional info, but that's something I can check and follow up with you.
Simply put, I was trying to make sure that the governor's office and the legislature was on the same page here.
And if I could interject, I think they are, because this deals with employee recruitment and retention efforts, and the money that you get for this is intended to be used towards that.
Yeah.
And I do believe, if I remember right, the governor was supportive of those efforts.
Okay.
Just because of the shortage that we're seeing in healthcare in general.
Okay, thanks.
All right. No other questions or comments. There's been a motion and a second to support 1089. Please vote. There we go.
Motion passes 7-0.
Next is other legislation. Any questions or comments on other legislation? Larry?
Larry Store, 5015 Lafayette Avenue, Omaha, 68132. This is another example of why I have asked and been denied for you to put the Open Meetings Act onto the agendas for two-way conversations. You guys with us, back and forth. You can't interrupt. Yes, you can invite me to ask questions, or you can invite me to stay in and answer questions. But that's not really good enough in a lot of cases. Now, this 2-on-1 thing, real quickly.
No,
is
Larry,
that,
we're already past
okay,
that one.
I think the city has a legislative bill that allows people to take the pressure off 911 to call in, and with those silly like calls to say, oh, I think Larry is maybe touched. You need to send a ride-along expert with a police car out to see, maybe have him detained. Anyway, enough on that. The main purpose here is the critical race theory and comprehensive sex education. Time that is being spent in the state halls, different bodies such as the Nebraska Department of Education, State Board of Education, sometimes the school board associations. That stuff is making citizens very irate because it is evil. It is taking away the responsibility of people to control their own families and their own education about those topics. It needs to be stopped. It's creeping towards Omaha. It's been in some of our resolutions at the city level, whether you want to admit it or not. The language that is used is proposed by bodies that have more power in these chambers than I do, such as the National Association of Counties, Association of Municipalities, Association of Governors. These are all outside people. Those are progressives. Well, let me tell you something about the progressives on this bill. LR 20, 27, 231, LB 447, LB 517. Those are all things that provide more power to the state than to the family, to the mother and fathers. Nebraska Family Values, for example, says progressive senators introduce nearly twice as many bills compared to conservative senators. True or false? Here's a sampling of bills that, if passed, would be a major assault on our First Amendment or fundamental parent rights. I just read those. I won't read the definitions of them, what they were proposed for to do, but it has to do with all those, I don't know, gender, misgendered, transgendered, ingendered, outgendered, all these different terminations. That's going to confuse any children. And that's what this is about. Adolf Hitler said, your children now belong to us. And that's happening through these things and through the Learning Community Council and early childhood education, which, by the way, did put some daycare centers out of business, didn't it? Thank you.
Commissioner Rogers?
Hold up, Larry.
Larry, you have a question?
Yeah. Got a question. Define for me what critical race theory is.
You might not like the way I say it.
No, I want to hear what your example is, because I want to see if it's what because this is being.
It's trying to rewrite the history of our founding, for one thing, and it's trying to pit you and me against each other because I have white privilege and you don't. I'll give you a real good example. The state legislature, he might be a friend of yours, Chester Wayne. I mentioned last week, I believe. He inserted into the legislative debate on amending the Constitution, which he does not understand. He inserted critical race theory into that by claiming that it was totally unfair. It was white privilege. The founding fathers didn't let him in the room. The founding fathers didn't let women in the room. There's lots of different commas there. That's what it is, Mr. Rogers.
Okay.
Now listen, excuse me, let me finish this.
You're on time, so I just asked you a question.
When black people.
I asked you the question. No, I asked you the question.
It's Marxist, okay? Marxist.
So let me just for everybody here. Critical. No, it's.
He
I
asked a
asked the question.
question, Jim. I just told him he had his time. Yes, you can. Yes, you can. At this part, Jim, you're out of order. Go ahead, Commissioner Rogers.
So-
Go ahead, Commissioner Rogers.
You know that it's allowed in this because it's basically a topic matter.
Commissioner
No, it's not.
Kavanaugh, you're out of
Well,
order. Thank
Can you yield to my time though? So you ain't got to come back. I just want to know for the record, you need to read an article by a guy named Jelani Cobb and understand what it is. And just for the public, no, I
All right,
asked you the question.
Larry,
So just for the public,
May I just say?
No, you cannot. No.
I asked you the question. Just for
No,
the public,
Larry.
if you got a kid that's in elementary school that understands critical race theory, your kid is a genius. Critical race theory is a law philosophy that's used, and if your kid understands that, your kid needs to be on the select list of elite people. So, I mean, you under the rules, you don't get a chance to challenge it, and I just needed to, in my spirit, knock this out because this is being thrown out there like it's the end of the world, and it's a dramatization. Thank you.
Thank you. With that, we do have need for an executive session, litigation, contract negotiations, and personnel. Is there a motion to go into executive session for those purposes?
Yes. So moved, or second.
Motion by Commissioner Rogers, second by Commissioner Morgan. Please vote. About what? Uh-huh.
Motion passes 7-0.
Recording stopped.
Motion to reconvene and adjourn passes with Commissioner Garcia is absent, all other commissioners present voting yes. We are adjourned at 12:32 p.m.